Hi everyone, it's Connor here from Durham Hearing Specialists. I hope you're doing well and welcome to another video. We've got quite an interesting case here. What you can see in the ear canal is right in the back there, that grey skin, that is the, or at least part of the eardrum, and I'll mark it with a black arrow right there. But other than that segment, it's a bit of a quagmire in here. So there is a lot of very dark wax and it looks quite shiny and glistening, and that's because preemptively I've applied some olive oil to this ear. Now the reason that it looks like a quagmire is because this patient has used sodium bicarb drops long term to try and keep this wax from building up. And sodium bicarb is, personally I find it very good situationally. So if there's wax adhered to the eardrum, then I will sometimes tell that patient to come back in a week after using sodium bicarb in the hopes that it will sort of unattach those adherences and I can suction it away. But for long-term use, what sometimes happens